Hey everyone, today's episode is going to be most useful to people who are considering going to therapy as well as to mental health professionals, especially mental health professionals. So, if you're listening and you are a therapist, you might want to grab a pen and a paper because what I'll be talking about is something that directly affects your work. So, the topic of discussion is self disclosure between therapist and client. Ordinarily, we expect that when clients come to therapy, they will disclose themselves to the therapist. That is a given. That is the structure of therapy. The other side of it is that therapists also disclose themselves to their clients. And they do that by telling them about their personal experiences, telling them about their mental health, telling them about experiences they have had in the past. If it's a therapist who's working with a client to help them deal with loss and grief, the therapist might tell the client about a time they lost someone or a time they were grieving and how that went for them. So it could be any number of things that the therapist could be self-disclosing. So the reason I'm talking about self-disclosure today is because when people discuss self-disclosure, there's always one blanket statement that is put out there. Therapists, stop using self-disclosure. Stop telling clients things about yourselves. Stop telling clients about your personal experiences. If you are a therapist, you've sat in a counseling class, you'll remember that self-disclosure to a degree is frowned upon. Of course, there are reasons why it is frowned upon, but those reasons sometimes tend to be too binary. They tend to be such a huge blanket statement, an overgeneralization that you should not do self-disclosure. So today, I'll be talking about 3 different types of self-disclosure that exist and how to use them in therapy and why to use them. The thing you need to understand about self-disclosure as a therapist, as a client, as somebody who is considering becoming a therapy client is that self-disclosure is a tool that is used in therapy, just like any other tool that is used in therapy by your therapist to help you get closer to your therapy goals. If self-disclosure is being used for something else other than advancing the client's well-being, helping the client get closer to their therapy goals, then self-disclosure is being abused. It's being used inefficiently, ineffectively, in the wrong way. As a therapist, that is something that you need to keep at the back of your mind. Self-disclosure is a tool. Use it wisely. Wield it wisely. Let me start by saying that self-disclosure, as I'm speaking about it today, is borrowed from the book The Gift of Therapy by Avin Yalom. So these are the 3 kinds of self-disclosure that Avin Yalom talks about. The first one is the mechanism of therapy. The second one is the here and now feelings. And the third one is the therapist's personal life. The first type of self-disclosure, the mechanism of therapy. Yalom says, be transparent. As a therapist, you need to be very transparent with your clients about therapy and how therapy works. Ordinarily, the therapeutic process is very mysterious to most people. Most clients do not have any understanding of what therapy is. And now in the age of technology and people sharing mental health resources and stories on the internet, there are many clients who are coming to therapy when they are misinformed about what therapy is and what goes on in therapy. And then there's the third group of people who have been to therapy. They have had very many therapy experiences with different therapists. So when they come to see you, they come with knowledge that might not match how you work as a therapist. It is definitely knowledge that is influenced by their experiences. They're coming from a perspective where they have already had therapy, so they have some notions they expect out of therapy from you. And as you know, every therapist is different. And as a therapist, your work is to customize therapy for the client, not to make the client fit in a therapeutic principle or a therapeutic model. So with that kind of confusion, misinformation, and vague and abstract expectations from clients about therapy, if they come to therapy and you're not clear about the mechanisms of therapy, how therapy works, how therapy with you is going to work, what kind of modalities you use, what kind of techniques you apply, how you are going to approach their problem, if you are not being open about how much time they will have to spend in therapy, if you're not discussing about the demands that therapy places on clients, if you're not talking about the power differential between a therapist and a client in a therapy session, if you're not telling them about how therapy is going to impact their lives, if you guys are not discussing how much the client's life will change or not change because of the therapy you guys are going to be doing, if you guys are not discussing payment, you're not discussing location, you're not discussing time, you are not discussing who is going to be involved in the therapy, then the client is walking into therapy and feeling more anxious than they need to be just because of the secrecy and the mystery that is surrounding the therapy experience. And that's why Yalom says you need to be very open, very transparent about how therapy works, the mechanism of therapy. And that is a form of self-disclosure. The more open you are, the less anxious the client gets about what to expect out of therapy. And it makes it easier for them to set aside their own worries and actually engage with therapy. During this process, as you're telling the client about the mechanisms of therapy, is when you talk about the boundaries that exist in the relationship. You talk about confidentiality and its limits. You talk about the need for the client to be patient with the process, the need for the client to trust themselves as they carry on with the process. It's when you talk about all the things you'll expect from them, whether or not there will be homework. This is the time you talk about how therapy is going to progress. This is the time that you talk about their goals for therapy, what they're hoping to achieve, so that you can clarify whether what they're hoping to achieve or get out of therapy is actually in line with the things that you can get out of therapy ordinarily. You don't want your client walking around thinking that you are going to perform miracles. And the only reason they're thinking that is because you did not clarify that in therapy, people do not perform miracles. The mechanism of therapy, Yalom says, be transparent, be honest, be open, give total disclosure about the process of therapy. And I tend to agree with it because, one, I have seen it work very well. When clients have clarity about what is going to happen in therapy, they set aside their worries and their anxieties. They become more involved in the process because they don't have to worry about these other things on the side. They don't need to worry about what is going to happen to them or not happen to them. If your client is not clear about when to contact you, why to contact you, under what circumstances, if they don't have to worry about that because you've already clarified, then they find it easy to engage with therapy in its fullness. So that is the first form of self-disclosure. The second type of self-disclosure is revealing the here and now feelings. If you have read Yalom, you know that he is a big advocate for the here and now. And the here and now means what is happening in the therapy room when you are with a client. So when you're revealing the here and now feelings, Yalom says, use discretion. This means when you're telling the client about how the experience of being with them is impacting you and impacting the therapy session, be wise. Remember that the things that you say, the words that you use, and how you use them have a possibility of impacting the client's ability to engage with you in future. They have the ability of keeping the client in therapy or making them leave. There's a way you can interact with the client. There's things you can tell them. They take them to heart and they decide to leave therapy altogether. It is not uncommon for people to say things that are just very harmful, very painful, very damaging to clients. And even if you are saying these things because they are true, it does not mean that they need to be said harshly. The truth can be delivered kindly. So learn how to deliver difficult information to the clients with a lot of patience and tact. Just because you're challenging the client. I know challenging is one of the techniques we are taught in school about how to deal with clients. Just because you're challenging the client does not mean that you need to tell them harsh things in a harsh way. It's okay for you to be kind in your delivery. And it's also important, as Yalom says, for you to pay attention to what is happening to you in the therapy session, how the client makes you feel. If you feel that the client is distant, disconnected from you, if you feel like you guys are not having a conversation that is constructive, if you feel like the client is trying to hide from you, it's okay for you to tell them these things and help them understand how their presence influences your emotions. That's what Yalom is saying. Use this specific self-disclosure with discretion because it can go sideways very fast. You don't want to come off like you're blaming the client for making you feel things. So when you're telling the client about the here and now, what is happening in the therapy room, in that therapy hour, in that conversation that you're having, outside of the things that they're saying, but the way that you're feeling about the things that they're saying, be very careful. Deliver your message with a lot of diplomacy. Remember that your client is in therapy to have a corrective emotional experience. The other thing that you need to consider when you're thinking about the here and now form of self-disclosure is being aware of what issues you bring to therapy as a therapist and what issues the client is bringing to therapy. If you are conversing with a client and you're feeling like the client is distant, you're feeling the client is closed off, it's like they're not communicating with you, it's like they've shut you out, it does not mean necessarily that that is what is happening. And you need to be able to differentiate between those two things so that you do not place this emotional burden on the client, yet it is your own issue. And I think this is why I keep saying it's important for therapists to be in therapy if they are working with clients. You cannot bring your own issues into therapy and burden the client with your own emotional issues. That is not your time, it's the client's time. And so when you're thinking about revealing the here and now feelings, when you're considering telling the client how you feel shut out, how you want them to be closer to you so that you guys can have this important conversation, you need to be 100% sure that it is not your feelings that are coming in the way. This is not your unfinished business. You need to be very sure that the issue in the therapy session that is going on is the client's issue, not yours. So think about it that way. Again, this is rarely spoken about when you speak about self-disclosure. The assumption is usually automatic that you're talking about telling the client about your own things. So that's the second type of self-disclosure, the revealing the here and now. And Yalom says use a lot of discretion. Last but definitely not least is the third type of self-disclosure, which is revealing your personal life as a therapist to the client. And for this one, Yalom says use a lot of caution. The reason Yalom says that you should use a lot of caution is because the client is not bound by confidentiality the same way that you are bound by confidentiality as a therapist. If a client tells you things in therapy, you can't go out there broadcasting them, because unless it is in the limitation of confidentiality, like for example, they intend to kill themselves, they intend to hurt somebody else, or there's an abuse of a minor. We all know the limitations of confidentiality, right? If a client tells you things in therapy, you don't get to go and talk about them out there. But on the other side of this coin is, if you tell a client things in therapy, they can go and broadcast those things out there to the world, and there's nothing you're going to do because the client does not owe you confidentiality. You owe the client confidentiality as a therapist, and you cannot tell them something and then tell them, please don't go and tell other people about this. Things you don't want repeated in the public arena, do not share them with clients. Of course, clients are human beings, and as human beings, when you're having a conversation with somebody else, you will be curious about their life. You'll be curious about what is going on with them. Clients will come to therapy and ask therapists about their own personal lives. They'll ask them, are you married? Do you have kids? Where do you come from? Do you have a good relationship with your parents? Do you have siblings? Where did you go to school? They'll ask a number of questions. This is not always the case, but it can happen. It is okay for you to answer these questions, but also follow up to find out where the client is asking. Some clients will ask, are you married? Because they're looking for a therapist who is married, because they feel like a therapist who is married would understand their problems better than one who is not married. Some will ask, are you married? Because they feel that a therapist who is unmarried will understand their problems better than a therapist who is married. Maybe they are gauging to see if you would really understand the nuance of marriage. It could be any other question that the client will ask you. It's okay for you to follow up and find out why they're asking the question. It could open a lot of fertile ground for you guys to explore things that they never brought to the surface before. So don't automatically say, I will not tell clients things about myself if they ask me. It's okay for you to tell them. But you need, again, to remember that, as we've said, self-disclosure is a tool, and it is a tool to be used to advance the client's well-being. There are some questions that are very innocent. The client is just curious because you are this enigma that is hidden behind professionalism, and they are just curious because they are human beings and they just want to know. Sometimes therapists can use this self-revelation because they want to meet their own emotional needs. You want to feel validated. You want to feel important. You want the client to admire you. Sometimes that can backfire on you very fast. You may tell a client something and they are automatically put off by your revelation because they feel like you are comparing the experience to yours. So you need to use a lot of wisdom before you just tell a client things about yourself. I think another fear that always comes up for therapists is that if they respond to some of these questions that clients have, the client will continue asking and asking and asking more and more questions. But most of the time, that's not true. Sometimes clients just ask the most basic questions about you because they just want to know you as a human being. That's the third and final type of self-disclosure. As we've mentioned, the first type of self-disclosure is the mechanisms of therapy. How does therapy work? What will it entail? Why is the client there? What are the goals? And all those things. Be very, very transparent about that. The second type of self-disclosure is revealing the here and now feelings. Yalom says, use a lot of discretion, use a lot of wisdom. Third, and definitely not least, maybe even most important type of self-disclosure is revealing your personal life. Yalom says, use a lot of caution. I don't know if this is something that you've ever thought about as a therapist. I don't know if this is something that has been clarified to you. Self-disclosure is not just one thing. It can be these different types of self-disclosure. As a client, I don't know if you have gone to therapy and your therapist has engaged with you in any of these three types of self-disclosure. Have they told you anything about themselves? Have they told you anything about the here and now, the process, being in therapy, how it feels like being in the therapy hour with you? Do they check in to get your feedback and understand that you're getting the things that you want out of therapy? Have they discussed with you the mechanism of therapy? Do you have clarity about what therapy entails? Why you're in therapy? What you're going to be doing in therapy? How long? For what reason? Those are things that your therapist needs to discuss with you. You need to have that conversation in the very beginning, and you need to have those things clarified as you continue with the therapy so that you are not left behind and the therapist thinks that you guys are working together. Therapy requires a lot of wisdom from the therapist. Remember, the therapist is the tool of the job. You need to take care of yourself as a therapist. You need to take care of your mental health, and you need to go for your own therapy so that you do not bring your issues into the therapy hour with the client. You need to be getting a lot of supervision. Peers can supervise you. You can get supervision from a professional supervisor, somebody who is more senior in the profession, somebody who can guide you and work with you. You need continuing education just to understand how to do the work better. So don't limit yourself to just the education you got in class, because it's never sufficient for the work. You need a lot of wisdom to make these decisions, to decide whether to disclose or not to disclose about your personal life. Again, it's a tool. Use it wisely, just like you would use any other therapy tool. Use self-disclosure very, very wisely. With that said, let me know in the comments what you are taking out of this episode. If you're a therapist, which of these self-disclosures do you struggle with the most? If you're a client, which one of these self-disclosures have you engaged with your therapist? Which one has your therapist used on you? If you are somebody who is considering going to therapy, which one are you most curious about? Let me know in the comments. If you have any questions regarding psychology, therapy, mental health, I'm always an email away. My email address is safespacearena@gmail.com. With that said, I will see you on the next episode. Take care of yourself and take care of your mental health.